Hi, I'm Luiza Bradasch Kohler, veterinary medicine student in the Federal University of Paraná, and under the orientation of Professor and Dr. Simone Toste de Oliveira Stedley, I present the project Abdominal Palpation in Dogs, ascites model for fluid thrill test and abdominocentesis. This project was developed in the Laboratory of Humane Education and Alternative Methods, LEMA, in the Federal University of Paraná. Animal prototypes have been created based on the public demand to reduce the use of live animals in the teaching of veterinary medicine, so that animal welfare is guaranteed in the learning process in higher education institutions. One of many clinical alterations seen in the internal medicine of small animals is the accumulation of fluid in the abdomen of dogs, condition called ascites. Ascites diagnosis is made through the fluid thrill test, which is performed using both palms of the examiner, placing each hand on each side of the abdomen and making slight strikes in one side and feeling the fluid wave on the other side. After the diagnosis is made, the fluid must be drained to allow its microscopical evaluation for clinical diagnosis and to provide comfort for the patient. In order to drain this fluid, abdominocentesis is performed by placing a catheter 1 or 2 centimeters caudally to the umbilical scar. Therefore, in order to demonstrate the need of creating animal prototypes for university students to train veterinary clinical techniques, this project sought this goal by creating a synthetic model of fluid thrill test and another model of abdominocentesis. For the fluid thrill test model, a stuffed dog was used, on which an abdomen simulating ascites was adapted. One female condom filled with water was used, covered by a layer of silicone for greater resistance. The entire model was covered with plush fabric to better fit the abdomen. For the abdominocentesis model, a dog simulation was made using expandable foam for the body, wire and automotive foam for the limbs, plasticine, cold porcelain, methyl methacrylate, and resin ice for the head. Specifically for the abdomen, to simulate ascites, a latex balloon was filled with water and covered with layers of bandage and high flexibility silicone rubber to provide a complete seal. EcoFlex silicone was used for the skin, and the umbilical scar was simulated by injecting medium flex silicone rubber through a syringe with a needle. The abdomen was then attached to the rest of the body, and finishing touches were made using plush fabric to wrap around the entire model. The synthetic models of the fluid thrill test and abdominocentesis in dogs were similar to the procedures performed on real animals, which were tested by students in clinical classes in the Federal University of Paraná and by 2 veterinary doctors. The clinical techniques studied in this project are relevant for training a practice which, if done incorrectly, may have clinical consequences for patients, such as peritonitis and iatrogenic hemorrhage, justifying the importance of prototype training before clinical practice. In addition, the models can be reused several times and easily reproduced by any institution or student. These were the references used to create this project. I appreciate the attention and wish you a great event.